So for clearance, what we're looking at is we will come out and do a pre-clearance inspection. We want to check those friction and impact surfaces, make sure that the contractor sanded down those surfaces, that they're not a problem anymore. We would like to see that before the work, they paint over that surface. That's what we're kind of looking for. We'll do a visual inspection of the paint and soil, make sure that all items that were on the order are addressed, and then we'll also do dust sampling. I do have the limits there on what would be allowable levels. So those are what the floors and the windows and windowsills need to be at for our clearance level. Health Department actually does provide 2 in-house clearance tests. The third one, if you don't pass those 2, you have to do a third one. You do have to get a third party to do it, and that we have to be present. So we do offer it up to 2. Once the clearance is passed, the orders are lifted, and you don't get to see us anymore. How disappointing that is. So disclosure rules. So any house, most houses built before 1978, sellers and landlords must distribute the EPA-approved information pamphlet. That's that blue Protect Your Family. I'm sure you guys have all seen this. So to anyone who is buying or renting your property, you got to make sure that you give them that pamphlet, as well as disclose any known information about lead-based paint or lead-based paint hazards. And then you must provide available records. So if we've come out and done a risk assessment and you go to sell your property, you have to provide them with the records that are risk assessment to identify what hazards are. As well, contracts and leases must include a lead warning statement within the lease or as an attachment, and it must be signed by the buyer or the PC. That the seller or the landlord has complied with all disclosure rules. They must sign in a date. I do have more information on disclosure and wording for your leases and stuff. If you're interested, I do have some sample wording and stuff like that. Renovating, remodeling, and painting rule, the RRP rule. Should touch base a little bit on that. It is a federal law that requires a contractor disturbing painting services in your home that they must be certified and follow specific practices to reduce lead contamination. As well, whenever a contractor is doing work in your home or you're doing work in a unit, you do have to notify the tenants, the occupants, and give them pretty Renovate Right pamphlet as well. So our closed lead hazard control program. Back in 2014, we were awarded another $3.4 million federal grant from HUD to reduce lead-based paint hazards in residential properties. With this money, we hope to actually do about 225 units within the City of Cincinnati, within the limits of the City of Cincinnati. Essentially our goal is to create lead-safe housing for children under 6. That is our priority. Our properties that are occupied with young children in them, or properties that have young children visiting them. We will accept applications from vacant properties, but you will be required to make it available to low-income families with young kids. In addition to that, with this grant, it involves lead hazard control activities, paint stabilization, encapsulation, and could be removing components that have lead, as well as it does include possibly window replacement with energy efficient windows. We do get an environmental review when we do our projects, so we do, if they're historical, we will work with that and do those as needed. Properties may receive up to $8,000 per qualified unit. So if it is a 2-family or a 4-family, you could get up to $8,000 per unit. It is available for low-income owner-occupied as well as rental properties with low-income tenants. It is not limited to just owner-occupied properties. It's anybody that lives within the City of Cincinnati limits. Properties must be adequately insured and current on all taxes and bills. And the property must not have any structural deficiencies or any building orders or health department orders or anything like that. are just a couple of our projects that we've done. Yeah, these are some from our older, I think, previous grant. We've had 3 total the past few years. Just a few. So other services that we have within the health department, we do offer paint chip testing. If you suspect any areas that have might be lead-based paint, you can. We have a form that you can fill out. You can send them to the health department, and we'll test them and let you know what the result is, as well as our HEPA vacuum cleaner program. We do require a $100 refundable deposit. You will get it back if it comes back with all its pieces and working and preferably clean. And then we have a relocation program. It's actually through the city. Properties that we do risk assessments on and identify lead hazards, the tenants can get a referral from us that says there's lead here, they are eligible for relocation. They have to take it down to the city relocation office and apply and meet all their criteria and find a place, and we'll go out and make sure that their new place is lead safe as well. So it's not money we provide, it's through the city, but we do make the referral to them. So it is an option for some of the tenants. So that's our address and our main phone number and fax number. But I also have cards too if you're interested in anything else, or I do the intake for the grant program, so I would be the one you would contact if you want to apply. So.
Allison, I forgot to pass these out. It might be helpful. It's got the testimony on this.
Oh yeah. Which pretty much is everything in Cincinnati. Yeah, Patricia just handed me this. This is actually the blood lead testing requirements for children. And it's actually a state law that all Medicaid eligible children be tested at age 1 and 2. And then at 3 and 4, or 3 to 6 if they haven't been tested before.
To the speaker so I can pass.
So that is state law. And if you don't meet that criteria, then if it's in a high-risk zip code you need to be tested. Well, all of Hamilton County is a high-risk zip code now.
Oh my gosh.
So pretty much if you live in Hamilton County, you should be tested. If you don't meet that qualification, there is a questionnaire that they go through on there. And if you say yes to any of those, then you should be tested as well. Yes?
You said that if your houses were built before 78, you have to have a certified lead person.
If you have orders on the property, you have to have a licensed lead abatement contractor do the work.
Okay.
But RRP.
Yes,
Yeah.
RRP, if it's built before 1978 and you have a contractor coming to do work on your house, or if you're a property manager and you have and you do work for your tenants, you have to be RRP certified. That renovating, repair, painting.
The reason why I ask, because some houses that was built before 78 they didn't use the lead paint, and they had converted over from using the lead inside too. So what do you do in those cases?
Well, I think pretty much if it was before 1978, chances are there could be lead-based paint. They could have remodeled it since then, but it's not necessarily that the lead paint was removed. If it was on a wall surface, I don't know if they've actually removed the wall. They might have covered it up, but so there still could be lead-based paint there. It depends on what they're doing. RRP can be a whole presentation itself, and it's very inclusive. I'm sure Cynthia in our office I believe she's actually might be certified to teach it. I'm not quite sure. I think she used to be. She could probably do a whole presentation on that alone. If you're interested, I could definitely talk to her. But yeah, it's a very complicated.
Can I ask you a medical question?
I will try to help as best I can. I might refer to Angela.
When you describe the lead damage as permanent, does that mean that the lead contamination remains in the body, or the body is incapable of repairing?
I'm sorry, I couldn't hear all the way.
Now, I'm asking when the lead damage is described as permanent, whether that means that the lead remains in the body, or is the body simply incapable of repairing the damage?
Good question. The body is not capable of repairing the damage. And as far as the lead remaining in the body, that happens also. It can be stored in the bone. So, does that answer your question?
Yes, thank you.
I would like to add something though. I think the Centers for Disease Control and Prevention are coming out with a report next month about therapies, education for young children who are poisoned. No, you cannot reverse the damage, but just like with any disability, you can improve that child's functioning and ability to learn. So there's going to be this big drive on now. I know up in Cuyahoga County, this is one of our speakers for our event up in Akron. He's leading a task force that's going to be working with doctors about making those referrals as quickly as possible for lead-poisoned kids. And if you want to get services from BCMH in Ohio, you have to get there before the child's like 3. I mean, it's you have to move quickly. So I know that this will be a whole nother thing that ODH may begin working on, or they may just wait and see what they can handle, what the CDC recommends.
I guess I'll go ahead and piggyback on that. So typically what happens is you want to treat, pretty much what she was saying, you want to start treating what the problem is. So if you have a child who's hyperactive, we make referrals to either children's or the children's home. So you're going to treat the issue in a nutshell. So if the child's hyperactive, you're going to refer them to children's home, you're going to refer them to children's hospital, they have behavioral health services there. So that's what you're doing. You're not necessarily completely healing the issue per se, but you're going to, like she said, just try to help the child have a better quality of life with the damage that's already been done. But the lead does remain in the body. To piggyback on that, the levels do fluctuate, the blood lead levels, in case anyone had a question about that.
We have another speaker, right?
Yeah. Oh, Cooper has a, you want to do your question quick and then we'll let Daniel talk?
No, well, okay, sure. So who does the testing? So someone finds out that they're in a exposed, they may be exposed, they go to a clinic, they go to their pediatrician?
Great question. So that's partly why we're here. Yes, is to just get the word out, because unfortunately a lot of children are not tested.
Right.
So if you have a sister, cousin who has a child in that age range, 5 or younger, actually 6 or younger, you can have that conversation. If you know that they're living in a home that was built before 78, they may not know anything about it. They may be very well aware of it, but you can encourage them to bring it up to their pediatrician. They will go to their pediatrician. If the pediatrician is not able to do the testing for whatever reason, they can come to a health department clinic. That's a pretty easy number to find if you actually get on the website now. And then they also have children's lead clinic. They have 2 doctors there. That's what they do. So they can be tested there also.
And to piggyback with the Cincinnati Health Clinics, you can actually get, they can go to any one of the Cincinnati Health Clinics, and if they, I believe, are age 1 and 2, they can get a free blood test. And then if they're older than that, they haven't had a blood test before, they can get one free one as well. So they do have other options available.
I work a lot in Price Hill and work with Crossroad Health Center, and one of the things I've learned, and I'm Marty Maxfield from SC Ministry Foundation, is that the brain damage is done at 2. It doesn't have to be reported till 5. And in working with Brooke, what Crossroad is doing is having all of their children on vitamins with iron. And those of us who are older remember when we took vitamins with iron. Well, the mental model's been it's gone away, we don't need it, but not all children can eat healthy, low-fat foods high in iron, calcium, and vitamin C. So they tried prescribing it, the parents are thinking once the script's gone, they don't have to do it again. So from a systems viewpoint, it can be a low cost. It's $3 a month, $15 a year, because we can't get rid of all the lead. So just something to think about. I don't know how we change processes.
So why is that vitamin iron important?
Iron eats lead.
Yeah.
Okay, all right.
But it's not prescribed for male.
From a layperson.
Close enough.
Close enough.